And thank you, Patrick, and welcome everyone. Good afternoon. I'm Corey Bussey. As Patrick said, I'm the Vice President of Performance Strategy here at Icario. And we're very excited today to partner with United and Lauren Barca, who I will let introduce herself here in just a moment, to talk about this innovative and exciting program. One of the things that we talk about a lot here at Icario on my team and throughout the organization is social determinants of health, right? And I think for a lot of the folks who are probably joining today's webinar, SDOH tends to be as much theory as it is practice. In fact, it's probably more theoretical than it is practical for most, because the questions when we start asking about those central questions about what are the kinds of barriers to care that our members are experiencing, the answers aren't necessarily readily available to us to identify what steps we can take to practically solve some of the issues that are standing in the way of our members getting care. And so what's exciting for me most today about this discussion today and our guest from United, Lauren Barca, is the fact that United has really, in partnership with a number of other players in Central Tennessee, has really attempted to solve the riddle, at least in one aspect around this. And you can see that in the title of the webinar presentation today, with the unexpected link, and it is unexpected, between free diapers, better healthcare, and lower claims for Medicaid families. So without further ado, I'd like to introduce Lauren Barca, or rather precede Lauren Barca only to allow her to introduce herself. Lauren, welcome.
Thank you so much, Corey and Patrick. As they said, I'm the executive officer at UnitedHealthcare of Tennessee. I'm responsible for quality projects, care management, community engagement, among other things. But I am incredibly passionate about projects that make a difference for moms, babies, and families.
Well, let's jump in just a little bit, if you don't mind. One of the things that is unique about this particular project that we've been working on is the element of diapers, and what it might have been. What the question that a lot of the folks listening to today's webinar might have is what's important about diapers? Why diapers in particular?
Yeah, I love that question, because it's interesting that someone from a managed care organization would be speaking so passionately about diapers. But really, diapers just make sense for the entire health ecosystem. Diapers are not a covered benefit under WIC, under SNAP, which is also known as food stamps in some areas. The only way you can get diapers is with cash, and that's so hard for so many families. Diapers cost about $93 a month, and those costs continue to rise. It also, we know it impacts their social, their emotional, their physical health. Such a leading cause of stress for families. It really puts an intense mental health burden on the entire family. It's been linked to studies with domestic violence, child abuse. It can also lead to physical health problems with the child, sitting in a wet diaper for too long, leading to diaper rash and UTI, which leads to unnecessary healthcare costs. And then having to take an infant to the doctor leads to missed days of work for the family, creating that greater financial hardship. It's just, the cycle continues. So I started to get involved in this project when we ran some claims reports and recognized that we had almost $4 million a year in our Medicaid population for kids with diaper rash or UTI, and that cost is just incredibly high for us. But then thinking about the burden it is for those families as well. I'm a mother myself and have had children in diapers, and I know I've been out in public without a clean diaper for them, and just that little bit of stress it placed on me for the 15 minutes of a baby crying and feeling uncomfortable. And then imagine having that feeling all of the time, just that burden carrying with you. In Tennessee, overall, we know that 1 in 3 babies don't know where their next diaper is coming from. And in the Memphis area, it's even greater than that. 4 out of 5 babies, they don't know where that next diaper is coming from. So it's just so incredibly stressful.
So that's some of those numbers are astonishing, Lauren. And it as a dad, right? I am now many years away from the diaper years, but I can relate to exactly what you're talking about, where it's even that momentary feeling of not having a diaper in the diaper bag, or thinking you can sneak away for a period of time and you get stuck in traffic or whatever it is. Nothing. It's just a fragment of in comparison to what families who don't know where that next diaper is coming from must feel. So with that in mind, is there? I know that you've got some compelling stories to share about the success of this particular program and what it means to the members that you're able to serve through.
Yeah, absolutely. So we started a connections program, and essentially it's a way for that anytime a child or a parent or a sibling of a child in diapers receives recommended care of some sort, they get diapers as an incentive for that. So essentially it's thinking about ways to get patients into clinics, into providers, to get necessary immunizations and to keep them engaged with their PCP. We've really seen that diapers do make a difference. One of my favorite stories is about a female college student that we had. She was receiving Medicaid coverage through us, and she delivered twin boys in Nashville. Had learned of the Diaper Connections Program through a local community center, the Martha O'Brien Center, while she was pregnant. She then scheduled newborn appointments at her PCP for the twins after they were born at Meharry Medical Center. It's an FQHC here in Nashville, and received diapers for both of those babies and kept bringing them back on a routine basis and kept getting diapers. They came on frequent visits because they had those weight checks, since often when you're delivering twins, weight is such an important issue. So every single visit that she came for that weight check, she got diapers. She continued with routine care. They throughout their first birthday, they just turned 1. But the good news, the real huge success here is that mom was able to graduate from college. It was this summer, and we just learned this fall that she got a job at Comcast. So this is really our success story for the program, to think about how diapers truly do make a difference and are changing lives.
Well, and let's stick on that for just a second, because obviously the opportunity for this mom to go through a bachelor's degree program and graduate from it, and to have a career path now that hopefully will take her further. But you mentioned something here a moment ago that I want to center on, because this is something that we talk about with our with health plans a lot, and it's the importance of connecting moms and babies with primary care. And it sounds like one of the advantages that this program brings is that it allows not only moms to connect with that, particularly in Medicaid, where moms might not have a lot of experience either with the healthcare system at large, or particularly with a primary care doc, but getting them connected with primary care, getting them connected with obstetrics and gynecology specialists, and ultimately getting those newborns connected with pediatric primary care on an ongoing basis. Is that something that the program has seen as well, that regular and steady connection, utilizing these incentives to get mom reconnected back into a system that she might have been otherwise unfamiliar with?
Yes, we had to find the currency that was going to work for that continued and sustained engagement. And we found with this prenatal, postpartum, and newborn population, that currency seems to be diapers.
There's a question that, and Patrick mentioned, we'll be taking questions throughout, and there's one that came up that I think is super relevant to this particular piece, Lauren, and I'd like to just stop on it for just a second. One of the folks on the webinar has asked, have you determined the standard number of diapers to offer for peak engagement?
We have, in fact, we worked it out a little bit to figure out how many diapers we would give. We didn't want to give too many that they wouldn't come back for their next visit, but not enough in that they were continuing to struggle through that interim period. So we give 50 diapers per baby per engagement.
Wow, that's and on average, 50 diapers. How long do you anticipate that carries that infant through?
Mm-hmm. Unfortunately, it's only about a week or two. So we did have some opportunities to have some emergency diapers and some follow through. We were really thinking about sustainability of the project and how to get people to come back. So that will give you about a week's worth of diapers if you'll come to this appointment.
That's compelling. So from when you're talking about a week's worth of diapers and you're talking about the sorts of things that well, you mentioned it's $96 a week. So with a week's worth of diapers at $96 a week, you know, it's $96 that is essentially going hopefully back into the pocket of a family to use for other types of things. What's from a financial perspective, what other sorts of things does this kind of a program unlock for a family?
Yeah, we've actually done some research. We've taken a survey of what they have used the money for that they didn't have to spend on diapers. And we got an answer back from them. And these are just sort of the summary of it. Essentially, giving them the pack of diapers is half a tank of gas, allows them to spend $25 in food, pay for 3 hours of daycare, a week's worth of their utilities, which then also thinking about offsetting the cost of going to the doctor, the distance to the clinic, the gas to get there, just thinking through how it really does offset some of those costs to seeking care.
Well, and the other advantages that you mentioned a moment ago in the story that you told about the mom who was able to pursue a degree, pursue advanced education, that opened more opportunities for her. Is it too much to say that, you know, without a program like this, that may have been, if not impossible, less possible for that mom to accomplish that particular goal and start on that trajectory?
Yeah, absolutely. We think that well, we know we've had a huge increase in the number of visits since this happened. So we know that this allows people to be able to even go to the provider's office. And I'll get into this a little bit later, but we also recognized that there are some other things that we could do to try to bundle services in one place to provide more bang for the buck, so to speak, because we recognize that if there's anything that a struggling family has less of than money, it is time, and how to maximize their time so that they can get as much accomplished in one setting and in one visit at the same time, so that they can really take this and springboard to get so many things marked off their list.
Right. Well, and you make an interesting comment, and it ties to another question that we've got that's come up that I think is hyper relevant right now. There's a question that one of the folks on the webinar asks: can you share which appointments the incentive applies to? Are there particular mom and/or baby visits that are that you know, ironic, one of your quotes on purpose, qualify for these sorts of incentives?
Yes, so we worked a long time to think through this, and we wanted to make sure that that was a meaningful appointment, but also not too limiting. So any type of prenatal appointment, if the mom signed up for the Connections program, they get them prenatally, and she can start stockpiling. Any female postpartum visit, we do a bonus. We just in the last couple months did a bonus diaper pack for a completion of a postpartum depression screen. So at that visit, they would get double amount for the well woman visit as well as the postpartum depression screening. Any type of newborn well visit, or sick visit. At some clinics we tested. So we're still learning which ones seem to make the most impact. This is sort of we're flying the plane as we are building it. But we have seen the greatest success in those newborn and infant, the EPSDT exams is what we call them. So the well child, the required ones. We also have been testing some immunization fairs. We even tried a COVID-19 vaccine drive-through where we use diapers as an incentive. So to answer that, we're trying it with any and all things, but we recognize we want this to be impactful and sustainable. So we can't give diapers for everything every day, but we want to see where we're going to see the most success and improvement in those visits.
Right. So this is a truly a rare case, right, where we see a win-win. It might be simpler to understand where the advantages are, right? So you've typified, Lauren, and thank you, a number of benefits that both moms and infants are seeing as a result of this. But it's not just them, right? So there are positives that are coming through for all the players who are involved in this particular, what we're calling your Connections Program ecosystem. Can you talk a little bit about that?
Yes. So the most important part is that this has a win for everyone involved. Clearly, families are getting more diapers, and really that's an immeasurable outcome if you're thinking about changing generational violence and abuse, and reducing stress on families. But we're working to determine exactly from a healthcare and medical standpoint what we're getting back from that. From an MCO perspective, we are providing more value and lowering our unnecessary cost. We also have a reputational aspect to this. I want to be very clear that this is also a really good commercial for UnitedHealthcare, because the diapers that are packaged have a sticker, given to you by UnitedHealthcare. So it's material that's going out and helps us reputationally as well. We partner very closely with our diaper bank. I'm on the phone with him almost daily, Doug Adair, who runs the Nashville Diaper Connections Diaper Bank here in Nashville. They're a diaper bank that gives away almost 1 million diapers a month, and we have worked very closely. I see there's a question about sourcing. That diaper bank is our source for that, and I can get into more details if we have time. And then providers, it's good for the providers and the PCPs and the OBGYNs, because they are getting patients back into their offices. They are able to engage with those patients. Not only are they able to bill more because they can put in a claim for that visit. So every single service that they provide is a billable service. And then thinking about their quality metrics. When we're thinking about if they have targets they have to hit. In Tennessee, we have quality incentives. If you see a certain amount of your panel, and if a certain amount get a well child checkup, or for the OBGYNs, if a certain percentage get that postpartum screening. And so this is actually incentivizing them to participate with us, because they're able to improve that engagement and then those quality incentives.
Absolutely. And what I want to touch on, another piece that you mentioned, is getting members, moms and babies both, back into a clinical environment. With 50% of children in the country born into Medicaid every year, and the fact that we saw such a dramatic drop last year, in particular in well child visits and the immunizations that typically come along with them, what a compelling way to bring recently delivered moms and newborns back into a clinical setting, not only for all the other good it does, but just to get them back and get them seen, and to continue that, or in many cases to start that virtuous cycle of healthcare for those members is really tremendous. So this is one that with so many, as with so many programs, and this is no exception, it takes a village, if you will, to make something like this work. How do you get all of these potentially disparate stakeholders working together to deliver on a program like this?
Yes, it all started with an idea, and then we just started doing networking and connections from there. It started between UnitedHealthcare and the Diaper Bank. From there, we started talking to providers. Once we recognized what an impact this may have on back to school shots. In Tennessee, kids went back to school and had to have those immunizations up to date, as well as with the COVID-19 vaccine. We engaged together with the Tennessee Department of Health to say we'd like to join in the efforts to improve immunization rates across the state of Tennessee. We started bringing in other community partners. We brought in the Second Harvest Food Bank of Middle Tennessee to supply fresh and healthy food boxes, so actual produce boxes at all of these events. If we were doing an event, we did some drive-throughs where we had some community partners lined up, and at every stop you got something along the way that would be beneficial. With the Tennessee Department of Health, they got us in contact with the Department of Education. And at some of our events, we even did kindergarten registration. So those busy families could get kindergarten registration, all their back to school immunizations, well child checkups for the entire child age situation, and then we even had flu shots for parents and kids at that event. So thinking about how we can continue to find ways to maximize this to ultimately benefit our patients and families.
It's fascinating, because that's a program that works pretty hard. I mean, beyond the direct benefits of diapers for families, this is a program that works really, really hard across the entire continuum of your Medicaid population. So one of the things that we talk a lot about, as you might imagine here at Icario, is we're always trying to find ways to help plans find incentives that are most meaningful to their members. In the ways for incenting members and health action, like motivating people beyond, there's a lot of talk about engagement, but really what we're after is getting members to do those things, whatever the thing might be, in order to make healthy changes for themselves and for their families. How do diapers help you do that, to incent health action for these families?
Yeah, it's the carrot that keeps them coming back. Someone asked about other incentives. I know that there are other incentives out there. Feminine hygiene products, someone mentioned. We found that what makes this different is that we have a partner and a provider, so that I'm not trying to ship out diapers or another incentive from my office. We're not having to find a third party. What makes this special is that the Diaper Bank, on behalf of UnitedHealthcare, is able to have these live at the events, or so on site you get it. It's not like we'll mail it to you in a few days. Or for these clinics that have partnered with us, we just ask for a very small storage area, and it gets loaded with diapers. And then the provider is able at that time of visit to hand out the pack of diapers. So it's an immediate feedback for the patient and family. And I'm not having to coordinate, or my team isn't having to coordinate that from our office here. So that's how we have found that diapers are the right way, is that we have such a strong partner in our Diaper Bank who has really done the heavy lifting for us. And if we were to go to another incentive, I would not have that level of support that I do from that Diaper Bank.
Yeah, we talk a lot about that at Icario too, right? Where when we're talking with health plans in particular, we're talking about two things: immediacy and attribution, right? Where connecting members with a reward or an incentive, whether it be diapers or other types of tangible extrinsic rewards, the immediacy is really tantamount to success. Disconnecting those sorts of things that get into rewards and incentives, an activity divorced from a reward and incentive by 30, 60, 90 days while you wait for a claim to process, often negates the value of the reward and incentive itself, because often members don't even remember what they're receiving a reward and incentive for. Moreover, the attribution then, and you mentioned it, Lauren, before, that this serves as a terrific commercial for United. The sticker on the diapers that says, given to you, as a result of UnitedHealthcare, is that connecting that immediacy with that brand affinity, if you will, and connecting that for the member, because so often what we find ourselves discussing with health plan clients is related to member satisfaction. And satisfying members often comes as a result of creating that relationship between member and health plan that most health plans frequently don't have until something goes wrong, right? So members sign up for their benefits, 6 months later encounter their benefits, and something is, you can't see this doctor, you can't fill this prescription, you can't do this thing. What we're trying to do with programs like this is reconnect members with their health plan in a positive way, so that first and foremost interaction with a health plan starts a healthy and positive relationship, which leads to long-term member satisfaction. So you've done this, you've done a lot of these things, and as you joked before, you're kind of building the airplane while you're flying it. So you've done a bunch of different types of events. Can you talk to us a little bit about the sorts of things that you've done and how that's going? How the progress as the airplane has been flying, the progress that you've made?
Yeah, so in addition to just supplying diapers at those clinics that I mentioned, we also have been doing events. So in the last year or so, we're a little bit over the 1 year mark here. We've had multiple events. The promotional events were those that I talked about, where we gave them multiple services all in one spot, where we were thinking about how to get the most services done at one time. We've tried them at a variety of locations. So at our community partners, such as parks or community centers. We've done 14 at schools. These are all Title I schools where we know there's such a need for diapers. And then we've done 16 promotional events at some of our larger practices that are located in communities that we really wanted to target. Then we've also tried with 23 immunization events. This is a drive-through, get your immunization and also get diapers and other services, where no one had to park, get out of the car. Certainly we were a little bit more limited, but this was perfect during the height of COVID, or when the Delta variant came back, and we weren't wanting to put on this giant community event. I know you've got some slides later on where we have horses and snow cones and all kinds of things. The drive-through event was tailored more for safety. And so I think what's really important is that you flex what's needed in your own communities. And we've really tried to be creative and evaluate what's going on, not only with the pandemic, but what each individual neighborhood looks like and what they need, and to ensure that they'll be engaged in the process.
We've gotten a couple of questions now, and I know you have some thoughts on this, Lauren, but a couple of the questions that have come up in the Q&A have related to, is this just for United members? But one of the things that I was surprised and pleased to learn about the program as you structured it is that you're largely plan agnostic. Can you talk a little bit about that?
Yeah, absolutely. So as a reminder, any provider can bill for any service for any payer that they have in their system. So if they were administering immunizations or an exam to someone from a different managed care organization, the provider was still able to do that through these promotional events. UnitedHealthcare did cover the cost of the diapers. And then for those uninsured individuals who would come to one of our events, UnitedHealthcare, out of its community investments, its charitable giving, covered the cost of those exams for the uninsured individuals. One thing I need to let you know that's really been incredible is through all of these events, even with the multiple payers that we have in Tennessee, about 30% of them were UnitedHealthcare members. So we know it is helping to move the needle for us. But we also want to talk about, an individual who's is receiving Medicaid benefits. We want to ensure that they're healthy and happy too. So we feel like we're really contributing here to the overall system. And we're really proud of the fact that we're largely plan agnostic. I think one thing we're also recognizing is that with the way Medicaid membership changes, they may have a different managed care organization month to month, and we didn't want to be prohibitive and say we won't pay for you if you have X insurer. So the providers are able to bill, and then we're supplying those diapers.
Related to providers, there's another question in the Q&A that someone's asked. Who are the clinical providers doing immunizations at events or in schools? Are they local providers or FQHCs?
We have almost all of our clinics have been our FQHC. Our largest clinic that participates with us is Meharry Medical, which has over 10,000 of our members here in Tennessee. So it's a huge pool for us. We do have some local PCPs that are not FQHCs, but are in rural areas. So we really wanted to think about how to get out of just urban Nashville, to think about recognizing this is also a huge, there's huge opportunity in rural Tennessee where they don't even have access in their county to buy diapers. So thinking about their crossing the county line to have to purchase a diaper was really concerning for us. So we started to reach out and make connections with PCPs as well who are not operating as FQHCs. So we've kind of taken it location by location.
Okay. So you mentioned the kindergarten registration, and we'll get into some of the, I love some of these pictures, but you mentioned kindergarten registration a couple of minutes ago. And I'm just wondering if you can kind of walk us through the way that in this one example, how kindergarten registration events work for this particular kind of a program.
Yeah, absolutely. So this was a kindergarten registration day. It was a single date and not an ongoing. Not an ongoing promotion. We sent out a mailed flyer to all families that we knew had upcoming kindergartners with younger siblings. So through our data, we were able to query down to that list. We sent it out. We also advertised on a radio station that is quite popular in this. This was at Meharry, by the way. I know I've mentioned them several times. They've been such a good champion for us. We asked them, what radio station do your patients listen to? And they had one right off the top. So we did an advertisement there. We worked with local schools to have them put flyers in the take-home folders. We did some call campaigns where we had some of our staff actually calling some families to let them know when and where this event would be. So we really tried to think about it from a variety of angles. Next time we're going to try a texting strategy for one of these and see how that goes, so that we're not utilizing the manpower on the phones. But we ended up with a really great day. Over 300 families showed up to that event. Now, not all of them got registered for kindergarten, but when you put anything on the radio, you expect to get a crowd. And so what would happen at the event is we had, you can see there on the lower left, some door greeters with some stickers, which would kind of help direct people where to go. We tried to be incredibly organized. We separated the areas out. We put arrows on the floor so the family could just kind of follow the arrows along. and really thought about a way that would make it easy for the clinic to move through the workflow as fast as possible, but also not keep a family, waiting too long or having to walk too far.
Right. There's another question that I think is interesting, and I'd like to pull over and see if we can address it, because we bump into this a lot with anything that we do in Medicaid. State requirements stipulate that the state needs to approve, right? And so the question is, did you have to go through an approval process with your state regulators in order to pay for diapers? Do you have state requirements that must be met in order to fund this kind of a program? So I would love to hear more about what the state requirements are in Tennessee and how they could potentially be applied to other states, as others who are interested on this webinar contemplate how they might, think about approaching a program like this in their own state.
Absolutely. Okay, so the first thing that you need to know is that we use diapers as an incentive. We cannot say that we pay for diapers, because diapers are not a benefit under Medicaid, WIC, SNAP, any state or federal program. So the first thing is that you have to use the right lingo so that you don't get in trouble with anyone. Diapers are an incentive. We have an approval process with the state of Tennessee where we put diapers as an incentive, just like we were going to give them a $5 gift card to get their flu vaccine. It's a similar approach. And that's for in-office clinic events, meaning routine, they go to the doctor, they got their shot, not an event. So in an event, these are a free gift that we are giving away. And as long as we have diapers as an approved item that is a giveaway, then we don't have to count it as an incentive, track it as an incentive. We are tracking it internally so that we can try to help determine some ROI here. But essentially, we are able to make a donation to the event. So either through a charitable donation to the Nashville Diaper Connection, or through our community engagement budget, that these will be a giveaway at the event. That's how we've been able to fund the diapers for the public one-off events.
And so,
and that's Tennessee law. I want to be very specific. I have no idea about how any other state handles any of their approval process.
Yeah, and that's something that we talk a lot about around here too. When one state, one state. And so there are always considerations that vary once you cross state borders. So this is unique to Lauren's experience in the state of Tennessee. Doesn't necessarily apply to a state where you're contemplating a program such as this. So the next couple of slides in this deck that kind of are backstopping our conversation today have some really powerful results. And so we're going to get a little bit into the numbers and stats of the program that you've been running in Central Tennessee. I would just love to hear your thoughts about the numbers, but also the direct feedback that you've gotten from program participants through surveys, and the kinds of metrics that are important to all of us in the healthcare business.
Yeah, so like I mentioned, we've been doing this just over a year. These are the stats at the end of 1 year of the project. So we're excited to see how this continues to grow. In 1 year, we distributed over 300,000 diapers and served more than 6,000 unique babies with those diapers. And then thinking about what would happen, what they would spend their money on, almost everyone mentioned that they're going to go buy food with this money that they didn't have to spend on diapers. So it goes to show that really diapers are such a need, as well as food. Thinking about how providing money in one area frees up money in another. We also have some statistics when we're thinking about what happened specifically with UnitedHealthcare members. I know someone had asked for some data. So you can see our EPSDTs, our well child events are on the rise. This is specific to our members. We saw a huge increase in our medical engagement rate. That's repeat visits to the PCP, and an uptick in total families served that were UnitedHealthcare enrolled families. So a huge difference. I do want to tell just a quick anecdote, if I may, about our very first event. We had planned a drive-through event at our as our first one at a clinic here in Nashville, and it was raining that day. And I remember telling Doug at the Nashville Diaper Connection, I'll be happy if we can just get 10 families here. If we can just get 10 cars here in the middle of this rain, in the middle of a pandemic. This was in June or August, thinking about, can we just get some people here? And I'll tell you, we had a line of cars around the block, even in the middle of the rain. We ended up with I think 5 times the expected amount of individuals. So it goes to show that a little bit of effort and a little bit of investment can go a very long way. And the fact that we're sharing in all of this together, and the burden isn't solely on the health plan, that we are able to rely on other partners.
Well, and I know, Lauren, that you have some thoughts on sort of what's in this for United that go beyond the stickers on the diapers, right? We've talked, you started the conversation talking about the millions of dollars spent on diaper rash and UTI claims. Can you talk a little bit more about that with respect to the way that diapers are making a difference, not only for the members served, but what will keep United continuing to do a program like this?
Yes, so now that we have a full year of completed data, we are really digging into the weeds of what that means for us. So we're able to the good news is we started at the very beginning saying we just need to make sure we know who these members are. Let's just, get their name and see if we can match it with a social or a member ID. And then as we've gone along, we've kind of learned some lessons about what we actually need to be collecting and figuring out. So it's not been perfect, but at least from the very beginning, we had the foresight to realize we needed to track the who. And so now we're going to be we're in the middle of a study of really a pre-post for those who were infants when they joined the program. If they were 6 months old when they got their first diapers, what happened compared to their first 6 months? And for those who have been receiving diapers their whole life, or the mom in that prenatal period, comparing them to a peer in the same zip code. So trying to do a matched cohort study. So a lot of data analytics going on right now, really thinking through how much we have saved in sick visits related to those diaper rash, UTI, etc. That type of thing. So there's still more to come. We know that this is such a feel-good story for all of those involved, that we at UnitedHealthcare have continued to fund this. Certainly has been well worth the investment to recognize the ability that we are now having to make new connections, really get to know our providers, get to see our members face to face, and for once to have some happy news around an insurance company rather than just feeling like we're the bad guys sometimes.
Right. Well, and one of the things that you mentioned is something that we talk a lot about here at Icario, and the difficulty simply in reaching members in a lot of cases. So connecting a member who is part of one of these events with, in your vernacular, either the social or the member ID, connecting that back with contact information, just so you can reach out to that member for other good things that are happening with the plan, with the members' coverage, et cetera, can often be tantamount to success or failure of being able to reach that member on an ongoing basis for issues related to their health and their coverage. With redetermination of benefits, with the growth that we've seen throughout states in the past 18 months, if not more, in Medicaid enrollments, and the forthcoming expectations around what CMS is going to require with respect to redetermination once, God willing, the federal health emergency is allowed to expire, is really critical information to have for health plans to be able to know who they're talking to and how to reach those members. You've talked a lot about the amazing results that you've achieved already. What does the future hold? I mean, you've got some thoughts today about you've taken a, I don't want to call it limited because it's incredible. 340,000 diapers and 6,000 babies doesn't feel limited to me, but where you're starting and where are you expecting to go with this program as it continues to grow and the communities served grow with it?
Yeah, absolutely. You can see there, we've been in 7 counties today. Some of those are incredibly rural. The one at the top, kind of off by itself, borders Kentucky in an incredibly rural area. That one we actually did at a farmer's market. Just as a little side note, we thought, where could we find a public place that we could get people to go in the middle of the summer? And so we actually set up that event at a farmer's market. But when we're looking at where we're going in 2022, we have 15 counties where we have providers who have already said they want to be part of this. The word is spreading. Some of these we reached out to, others have reached out to us wanting to participate. So really expanding our Middle Tennessee presence. We hope to be in, I know that shows all of Middle Tennessee there, but I'm hoping this will be a statewide program by 2024, really thinking about how to be in all 95 counties of Tennessee. And I'm out even now talking to some counties in West and East, trying to get them on board, as well as the schools and the FQHCs. So it's been a real labor of love for our health plan.
So as we're talking about this, I know there are others from health plans around the country who are listening to this thinking, I want to do this too. If you were to bite-sized chunk the advice that you'd give to other health plans thinking that they want to copy this idea, which I will say that Lauren and I have talked about this, it is okay to steal this idea. We'd be excited if you did. What advice would you give other health plans and other individuals who are passionate like you are about this, if they were going to try to replicate these results where they live?
The first thing is to have really good partners. You've got to find reliable partners for this project. The second is to know your membership. You need to know where there are gaps in your well-child network, where you know your rates are falling behind what they need to be from a HEDIS and CAPS perspective. Really do some research. Also, not just where you know people need to go to the doctor, but you need to know the population. As a native Tennessean living in Nashville, I have a really good sense of what Nashvillians are like and what that demographic is. But I also needed to expand beyond that to learn what it's like in rural Scott County, to really to not try to do a one size fits all. At some of our events, we've had interpreters on site because we needed to make sure that the primary language and preferred languages would be available to those individuals. So it's really about knowing your population and targeting it accordingly. I would also recommend that you figure out from the beginning what you think the data is that you will need to collect, and then try to change it as you need to. And then also just to be willing to flex too. We've tried a lot of things, tried flyers, tried postcards, tried phone. We're thinking about what would an IVR call look like? What would text messaging look like? How can we get this out there on our social media channels more? Do we need Doug Adair, we call him Diaper Doug, to start doing TikToks, thinking about what we can do to meet the population where they are, and to have individuals in the community engage with us.
Okay, so those are, and this is my favorite slide in this whole thing, because this is where we get into what you referred to before as horses and snow cones. What are the three key takeaways? And rest assured, for everybody who's on the webinar, we're going to turn the corner here in the final few minutes, and we'll get into some more dedicated Q&A, if you will, as opposed to taking you through more of the specific content. But before we do, Lauren, what are your three key takeaways for a successful diaper connection type of program?
Yep, I mentioned some of these previously. One, know your population, know what it needs, find the right partners, have the data support that you need to test this, and not just from a quantitative standpoint. You also need to be gathering those qualitative stories, those things that keep you going, those life-changing moments. And then just keep testing and keep trying new things until you get it right. We've had a few bombs along the way, the things that just didn't work, or it wasn't that great of a location. We had a really horrible traffic jam one time where the police were yelling at me. I just put on an orange vest. I'm not joking. I put on the orange vest and was out trying to get cars to go in the correct direction. So you have to be willing to truly jump in. You can see I'm there at a lot of these events, so it's a way for me to get out of the office and get to know the population that I'm serving, and I consider it to be just one of the greatest honors that I've had in my career. I do have one story I'd like to tell from these pictures, and it's to really be flexible and think about what works. If you can see the top middle picture there, there's a snow cone truck. And someone from the community there at the event. The person in the blue shirt is Dr. Joel Bradley, a physician, and he's actually doing a health history right there in line for the snow cones, thinking about ways in which we can be creative to get things done for people in the community.
Horses and snow cones are pivotal events. Well, let's leave the formal remarks there. Lauren, thank you very much. We'll turn to the folks on the webinar for additional Q&A. There are a couple of questions that came in that that didn't sort of fit organically into sort of the conversation as we had them, but I want to track back on a couple of them. One question we got is, do families, excuse me, do families have to comply with receiving their child's immunizations at the visit in order to receive the diapers? I think I know the answer to that one, but I'll put the rules, if you will, for how you organize these events back to you, Lauren.
Yeah, so it actually varies. If they're receiving a well child exam, they got the diapers regardless of whether they received the immunizations or not, because there was a service that was provided. Now, at a couple of our drive-through events, like a drive-through flu vaccine, if someone came through and said, I'm refusing the flu shot, but I want diapers, we had to respectfully say, I'm sorry, this is for, this is a flu vaccine. Now, it got a little gray. I'll just get into the weeds a little bit. Someone filled it out and didn't meet the qualifications to get the flu vaccine. We still gave the family diapers. So if the intent is to try to get immunizations or to get a service or to connect with a provider, we always erred on the side of diapers.
Right. Yeah. And then there's a question that's less about the program and more about how you're determining impact. This one's related to retention. Have you tracked to determine whether programs like these have any impact on membership retention within the health plan?
Okay, so our net promoter score rose in 2021. We are trying to correlate it back to diapers, and they have not been able to do that. I am certainly shouting from the roof that it was diapers that improved our NPS and improved our member retention. I don't have the data to back that up, and I know this individual is probably looking for some hard stats. That's still in progress. I'm hopeful, but I also am realistic and recognizing there could be several factors that may impact some of that.
That's right. I think that covers the number of questions that we've gotten through the Q&A. I'll give it another beat here or two, but as I'm staring down the barrel of 4 minutes to the top of the hour, I will say that, I think we've filled our time pretty darn well. If there are other questions that have not yet been addressed, and you want to make sure that we're getting to them before we conclude in this hour, please send those through the Q&A, and we'll make sure that they get asked and answered. Lauren, as we give it another minute, any other final thoughts that you might have?
Mine would just be go for it. Just try it out, test it on a small scale, and see what happens.
Sounds great. Well, with that, let's make judicious use of everybody's time here. Lauren, thank you. This has been delightful for me. I don't know about anybody else, but this has been a delightful use of an hour. I have really enjoyed working with you to get the program to this webinar to where it is today. I think I speak for all of the attendees in both thanking you for presenting this, but also congratulating you on such a successful and exciting program.
Yeah, thank you so much for having me.
You bet. And I will turn it back to you, Patrick, as we close the hour.
Perfect. I'd like to reiterate what you said. Thank you very much, Lauren and Corey. This was not only a fascinating presentation, but it was truly eye-opening. The problem you presented and then this great solution was invigorating to hear about. So I want to thank you both very much for this. And then, of course, thank our attendees. Again, you'll receive the slides and a YouTube link to this presentation in the coming days. Feel free to reach out with any questions. And once again, I want to thank Icario, a great partner, a great supporter of MHPA, and of course, UnitedHealthcare Tennessee for their great support as one of our health plan members. These organizations are key to MHPA and our success. So with that said, thank you all for joining us. And again, reach out if you have any questions. Everyone have a great afternoon.